Welcome back to our colonoscopy preparation podcast series. Today, we are going to talk about T-1 evening, the preparation series. I'm Bimal Maharzan. We will guide you through the final steps of your bowel prep. This is the T-1 evening episode where every step you take is crucial in successful procedure tomorrow, the next day. But before we dive in, a reminder that a guts fair is not a clinical firm or a healthcare provider. We provide self-help GI care tools and resources. Our goal is to complement your medical care, not replace it. And always consult with your healthcare professional for personalized advice and treatment. And our T-1 evening is informed by latest gastroenterology guidelines and augmented by my first-hand experiences, and I am a patient just like you. These insights aim to make your preparation process as smooth and as effective as possible. Our series is meticulously designed to walk you through each day leading up to your colonoscopy. Each episode builds on the last one, ensuring you're fully prepared not just medically, but mentally and physically. In this episode, we will focus on completing your prep. We will discuss how to continue consuming your prep solution, tips for handling any ongoing side effects, how to manage sleep disruptions due to frequent trips to bathroom. We will also go over how to ensure everything is set for your colonoscopy procedure the next day. So stick with us. By the end of the night, you will be fully prepared and ready. Your efforts, T-1 evening, are the final stretch in preparing for a clear and thorough colonoscopy. Let's not waste any moment. Grab your prep solution, make sure you are comfortable, and follow along as we tag along the final hours before your colonoscopy. Here's everything you need to know to wrap up your prep effectively. So as usual, we are going to follow Q&A format, and we are going to start with the most frequently asked question. The first question is about assessing readiness. The question is, how do I know if my bowel movements are clear enough to indicate I am adequately prepared? What should my bowel movement look like after finishing the prep to ensure I'm ready for the colonoscopy? So as you prepare the final stages of your colonoscopy prep, assessing the clarity of a bowel movement is crucial to determine if you are adequately prepared for the procedure. Knowing what to look for can give you confidence that the colonoscopy procedure will be performed effectively. So let me make few key points. In fact, two key points. Number one on clarity of bowel movements. Number two on consistency and frequency. Your bowel movements should progress towards a clear or yellowish liquid that is free from any solid matter. This indicates that your colon is clean and ready for examination. For example, initially, the output, your bowel movement, may be colored by your usual diet, but as you continue with the prep, it should transition to lighter colors, becoming clear like urine or lemonade. And next, about consistency and frequency. The frequency of bowel movements should increase initially, then stabilize after the prep finishes. The consistency should be watery without any fecal matter. For example, you might experience large volume initially, which gradually becomes less frequent but remains clear or slightly yellowish. So this is a very key this is a key factor. The bowel movement, the clarity, the frequency, and consistency. So when you know that the your bowel movement is as very clear and it's yellowish like urine, then you know is you are prepared. So initially, when I had it, so as soon as I took a prep, after a few minutes, I started getting a bowel movement, and first one was a large volume. So it just took out everything it had. Then I was, then, then I had multiple bowel movements. As I said earlier, the subsequent, the volume, the volume started decreasing, the solid particles started decreasing, and frequency started increasing. But after a certain the clarity is is complete, then my frequency started stabilizing it. I think the same thing may be true for you. So true for you as well. So in conclusion, understanding the desired outcomes of your bowel movements post-prep is key to ensuring a successful colonoscopy. So clear, watery bowel movements are a good indicator that your prep has been effective. If you observe that your bowel movements are not reaching the expected clarity or consistency, so it's important to contact your healthcare provider for advice. Because without clear, watery bowel movement, the next day's colony procedure will not be effective. So completing the prep thoroughly not only facilitates a smoother procedure, but also increases the accuracy of the diagnosis. So always follow the detailed instructions provided with your prep kit and keep it close contact with your medical team throughout the process. And also in T minus one morning episode and T minus one afternoon episode, we have talked about what are the prep solutions that are available, how to prepare, and for different categories of prep solutions that are available, we have given you a brief overview of the instructions that you can take. Again, the detailed instructions will come with the prep kit, and also to help personalize for your own needs, you can also contact the healthcare provider. And as much as possible, it's self clear and you can definitely be well prepared for the colonoscopy next day. So another very practical question is the unexpected illness. And here the question: what steps should I take if I catch a common cold, the flu, or any other sickness the evening before my colonoscopy? Should I proceed with the colonoscopy if I develop a fever or significant respiratory symptoms? This especially may be true during the flu seasons or allergy seasons. But again, what should you be doing? So, as you prepare for colonoscopy, these unexpected health issues like cold or the flu can complicate the process. It's important to know how to handle these situations to ensure your safety and the effectiveness of the procedure. So, again, I'll make 2 points. One, catching a common illness. Two, about developing fever or significant respiratory symptoms. So, about catching a common illness, common cold, if you develop symptoms of common cold or mild flu without fever, you may generally proceed with the colonoscopy as planned. However, it's crucial to inform your healthcare provider about the symptoms. For example, if you have a runny nose, mild sore throat, or cough, keep your healthcare provider informed. They might recommend taking certain over-the-counter medications to manage the symptoms without effective colonoscopy. For example, research shows that mild respiratory symptoms without fever typically do not pose a risk during anesthesia unless they significantly interfere with breathing. So, number two, developing fever or significant respiratory symptoms. So if you develop a fever, significant cough, or difficulty breathing, contact your healthcare provider immediately. These symptoms may require postponing the procedure to avoid complications. For example, if your temperature exceeds 100.4 degrees Fahrenheit, that is 38 degrees Celsius, or if coughing and breathing difficulty arises, these could indicate a serious infection or flu. The guidelines from the American College of Gastroenterology recommend delaying elective procedures in the presence of acute respiratory infections to prevent the spread of illness and reduce the risk of anesthesia-related respiratory complications. So colonoscopy is an important procedure. However, it's an elective one. It's for diagnosis or treatment. It's not a treatment options. So therefore, this can be postponed if you have a serious illness. So, in summary, the minor illnesses might not necessitate a change in your colonoscopy plans. Significant symptoms such as fever or severe respiratory issues require immediate attention from your healthcare team. So, always err on the side of a caution and communicate openly with your medical provider about your any health changes prior to your procedure. So next practical question is the transportation concerns. And we have talked about in our previous episodes as well, but we want to remind you here because sometimes or most of the times, even as simple as not having a transportation, not having a driver can cause in canceling or postponing it or rescheduling it, and not all of those can cause complications or problems, especially around administrative burdens, cost, and again, your mental health and anxiety. So having those answered is very practical. And here are the questions that most people have. So what alternatives do I have if I don't have anyone to pick me up after colonoscopy? Are there specific programs or arrangements or services the clinic or hospital can help in regarding post-procedure transportation? Again, arranging safe transportation home after colonoscopy is a critical safety measure due to its effect of sedation used during the procedure. So 2 points. One, lack of personal pickup options. If you don't have a friend or family member available to pick you up, discuss alternative transportation option with the clinic beforehand. For example, many clinics have partnership with local transportation services that specialize in post-procedure care, offering safe and supporting travel options for patients without a personal support network. Because the studies indicate that patients who arrange safe transportation post-anesthesia are less likely to experience complications such as falls or traffic accidents, ensuring a smooth recovery. Number two, clinic and hospital transportation services. As I said earlier, ask your clinic about any specific transportation services they provide or recommend. Some facilities may offer shuttle services or can arrange rides through approved third-party providers that ensure you are safely escorted home. For example, large hospitals often have contracts with taxi services or specialized medical transportation companies that are familiar with the needs of post-procedure patients. Hospitals and healthcare facilities are increasingly recognizing the importance of safe discharge plans, including transportation, as part of the quality care standards to prevent readmissions and complications. Therefore, to ensure a close, to ensure a safe return home after colonoscopy, it's essential to pre-plan your transportation, especially considering the lingering effects of sedatives. Again, let me remind you, discuss your options with the clinic well in advance of your procedure date to arrange the safest and most convenient transportation. Remember, safety is a priority and proper planning can help prevent unnecessary stress or risk. So we are in a T minus one evening and next day is a colonoscopy. Obviously, there may be some last minute concerns. And some of the last minute concerns are, can I drink clear liquids after preparing the prep solutions and until what time? How should I address feelings of hunger or weakness the night before the procedure? What can I do to alleviate any lingering side effects from the PrEP, such as nausea or abdominal discomfort? Are there specific symptoms from the PrEP that would require me to contact my healthcare provider immediately. So let me answer this one by one. Number one is about the hydration. So you can continue to drink clear liquids after finishing the prep solution until a specific cut of time. Typically, it's from 2 to 3 hours before your scheduled arrival at the clinic and up to even 6 hours as well. For example, the clear liquids that you can take are clear broth, tea without milk, and water are excellent choices to keep you hydrated without affecting the clarity of the color. So addressing hunger or weakness. While you should avoid solid foods, sipping on calorie-containing liquids such as sports drinks or clear juice can help manage feelings of hunger and provide some energy. So consuming a non-red sport drinks can offer some calories and help weakness without compromising the bowel cleaning process. So light caloric intake through clear liquids is often recommended to maintain energy levels without disrupting the effectiveness of the bowel prep. So it may be true for people who have chronic diseases or who don't have the habit of cleaning fasting. They may have hunger. For example, in my case, I was used to fasting 16 hours and also 24 hours on a liquid diet. For me, that wasn't concern for me. But however, I empathize with people who may have that kind of typical concern. Hence, I'm going through these strategies. And I said in T minus two as well, most of the times when we are hungry, it may mistake as a hunger, but instead it's a thirst. So drinking liquid, drinking electrolytes, drinking ORS will be helpful to give you the sense of satiation while in hunger. And again, remember, this is a very temporary procedure and temporary preparation. After a colonoscopy procedure, the next day you can have you can have the food back. And also, while preparing for this, there is another realization that how hunger is so temporarily. So if you can not eat for the next 15 to 30 minutes when you are hungry, actually the hunger dies out itself. It's very interesting how that happens. And there is actually a hormonal cycle. Maybe some other time I can talk about the hormonal cycle for the hunger. That if you just don't eat for sort of minutes, few minutes or half an hour, the hunger goes away. And again, in between that 30 minutes or 15 minutes of time, drink water to feel satiated or any other clear liquids, but no purple or red color or any other color because that can mimic the color of blood and hamper in the effectiveness of the colonoscopy. Next, let's talk about alleviating lingering side effects. So to alleviate nausea or abdominal discomfort, please continue to sip clear liquids, rest in a comfortable position, and consider over-the-counter remedies if previously approved by a healthcare provider. For example, ginger tea can help soothe the stomach. A heating pad might also alleviate abdominal cramps. For example, another tea is a fennel tea that also help alleviate the abdominal cramps or some bloating. And supportive care measures such as using heat pads and staying hydrated have been shown to effectively reduce discomfort associated with colonoscopy prep solutions. And another critical point is recognizing symptoms that require immediate attention. So, if you have symptoms such as intense abdominal pain, vomiting that prevents you from keeping down liquids, bloody stools, or signs of dehydration like dizziness or a significant decrease in urination, or the color of urine turn into dark brown, then you must recognize that it's time to contact your provider immediately. For example, if vomiting occurs repeatedly and prevents you from drinking any fluid, This could lead to dehydration and warrant medical attention because severe symptoms can indicate complications from the PrEP or underlying health issues. So this requires prompt evaluation to ensure safety as outlined in clinical guidelines from gastroenterological associations. So as you continue with the final preparations in the evening before a colonoscopy, remember that managing hydration, a- addressing hunger in approved ways, and knowing how to handle any side effects are all key to a successful colonoscopy. In any case, in emergency, keep in touch with your healthcare team about any concerns. Follow the guidelines, and soon you'll be on your way to completing your procedure with confidence. Stay calm, stay informed, and look forward to successful completion of your preparation. So another topic which may concern many people are sleep. The question is, how can I make myself comfortable for a better night's sleep despite the frequent bathroom visits? Are there recommended positions or strategies to reduce potential discomfort or sleep disturbances? Or there are mental preparation. What are some relaxing techniques or practices I can do the night before to ease anxiety about the upcoming procedure? And in the morning of the procedure, what should I do the first thing in the morning if my procedure is scheduled early? Are there any last minute preparations? So let's discuss this one by one, how you can maximize comfort and manage sleep despite the challenges posed by frequent bathroom visits. So maximizing comfort for sleep. Again, create a comfortable serene sleep environment by adjusting your bedding and room temperature. Consider using waterproof mattress protectors, placing extra towels or portable commodes if mobility is a concern. Again, set up a comfortable area near the bathroom with essentials like water, a book, or soothing music to minimize the distance and effort needed during the night. Let me talk about recommended positions and strategies to reduce discomfort. So, sleeping in a slightly elevated position can help potential discomfort and acid reflux, which can be exacerbated by the PrEP solution. For example, using an extra pillow to elevate your head and upper body can help. Additionally, lying on the left side may aid digestion and reduce discomfort. So, clinical recommendations suggest that elevation, in which your head is slightly above, and the sleeping from the slight position can decrease discomfort and improve bowel movement efficiency during the night. I think these positions are crucial. Maybe in the future, I'll talk about the sleep positions, uh, how impact our overall health as well, and sometimes breathing as well. So that's for some other time. Let me get back to the mental preparation. So preparing mentally for a colonoscopy is just as important as physical preparation. So let's talk about how to calm your mind, ease any anxiety that you might feel before the next day's procedure. So relaxing techniques and practices. I have briefly talked about these in T-1 and T-1 morning and afternoon episodes. So again, the simplest one is to practice the deep breathing exercises or guided imagery or meditation to calm your mind. For example, I'll give you three simple breathing techniques. One is alternate nostril breathing. Second is the 4-7-8 breathing practices, in which you inhale for 4, hold for 7, and exhale for 8, and repeating that. And third is the yoga nidra. I think that's our great simple tools that are available to calm yourself. And obviously, if you are trained in any meditation, such as transcendental or mindful meditation, or any form of guided meditations, you can follow those to calm yourself. For example, as simple as breathing and inhaling slowly through the nose, holding for a few seconds, and exhaling through the mouth can be helpful. And obviously, there are apps available for that. There are YouTube videos available for that. You can search for those. And in future, we will be adding those resources along with this guide as well. So therefore, please make sure you're relaxed, and if you have any anxiety, these techniques should help you. And obviously, the psychological studies confirm that these practices can significantly reduce anxiety and improve overall emotional well-being, making medical procedures less daunting. And let's move on to the morning of the procedure. So here is what you need to know to start your day to ensure everything goes smoothly. The first steps in the morning. Wake up early enough to complete any last minute preparations without rushing. Ensure you follow any instructions regarding medications or final steps of water. If your doctor has allowed you to consume clear liquids, have a small drink of water or apple juice is permitted up until the cutoff time provided. So adhering to these last final guidelines is crucial as they are designed to minimize risks during anesthesia and the procedure itself. So as we conclude T minus one evenings, remember that the key to smooth procedure lies in following these steps meticulously. Rest well, knowing that you have done everything to prepare and your healthcare team is ready to do the excellent care for you. We wish you a comfortable night and a successful procedure the next day. And before that, we also have before we ended, I just recall that I have one more thing to talk about. So, one is communication with the healthcare team. Is there a final information or confirmation I should relay to my healthcare team the evening before my colonoscopy? And some dietary restriction and chronic conditions. If I have dietary restrictions or chronic health conditions, are there additional considerations I should be aware of evening before my procedure? So T minus evening, we are focusing on ensuring that your healthcare is fully informed and your current state and any last minute details. Effective communication can significantly impact the success of your colonoscopy. So, so let me talk about two things like final information and confirmation. It's important to relay any final updates about your health or changes in your conditions to your healthcare provider before the evening. For example, you can confirm the time of your arrival, any medications you have taken, and report any difficulties you have experienced during the prep, such as severe nausea or inability to complete the solution. Otherwise, like if you have no symptoms, if there's a clear bowel, you're not feeling dehydrated, and anything else, I think you are already good to arrive for the scheduled time the next day. So you can contact if necessary, the but most likely you will not be necessary to contact if you follow these instructions very clearly. So addressing next point is about addressing specific needs for dietary restrictions and chronic conditions. So patients with specific diet needs or chronic conditions such as diabetes should confirm any special instruction with your team. So diabetics should verify when to adjust or withhold their insulin and discuss carbohydrate intake with if hypoglycemia is a concern. So again, we talk about that in T minus 7 and T minus 5 days episode. If you have chronic diseases, how you can handle last preparation. I think definitely adds some complication, but those complications can be adjusted with the help of a medical provider. The most important thing is to communicate openly about all your conditions, medication you are taking, the insulins you are taking, and other thing, because the well, the more informed your doctors are, the better they can help you tailoring and preparing for success. So as we close the T minus one evening's session, this episode, so remember that keeping an open line of communication with your healthcare provider is crucial. So ensure that all your questions are answered, and hopefully with this podcast, you know what question to ask, and most likely some of your questions or even most of the questions are answered here. But obviously, this is not a replacement to your healthcare providers, your suggestions or recommendations. So you can definitely ask them for your personalized and tailored recommendation from them. And we hope that this episode has been helpful for you to ask the right questions and to get some of the answers. And as we have been talking about, this particular episode or each episode comes with a user guide and a checklist. The purpose of user guide is to help you with a quick glance, ease of access, you know what activity needs to be done at what time with instructions and special notes. And along with the checklist to help you tick mark whether the activity is done or not. So that'll help you prepare for it because I know I have gone through this. So procedure is anxiety is overwhelming, and at that point of time, it's difficult to think through everything. But when you have a checklist or user guide, it's so much simpler because you just don't have to think. You just follow the guidelines properly, and also that triggers you think and ask questions. Hence, I believe that having this user guide and checklists are really handy, especially when you don't know what to do or you're simply overwhelmed, and these can calm you down. So as we wrap up this, I love to thank you. I thank you for staying with us through the T minus one evening episode of our colonoscopy preparation podcast series. We have covered a lot of ground tonight, from finalizing your prep solution intake to ensuring that you are comfortable as possible throughout the night. It's been an intensive evening. It's going to be an intensive evening for you because of frequent bowel movements, rushing to the toilet, checking whether your bowel is clear or not, making sure you're not dehydrated, your energy is not low, your your anxiety is not there, making sure that your hunger is not there. So there are a lot of things, but again, this is temporarily, this shall will pass, and the steps that you have taken, your dedication to following through with each step brings you one step closer to a successful colonoscopy. So by now, or by the end of the evening, your bar should be clear, your body should be well rested and hydrated. Remember, the effort you put in tonight impacts the effectiveness of your colonoscopy. You have done everything possible to prepare, and it's important to give yourself credit for managing this challenging preparation process. So, as we look ahead, join us again at T minus 6 hours episode before your procedure. So, in our next episode, we'll guide you through the final hours leading up to your colonoscopy. We will discuss what to do if you wake up still needing to use the bathroom, how to handle any lingering nervousness, and we'll ensure that you have everything ready for your arrival at the clinic. One final reminder, please review the user guide and checklist at one last time to ensure everything is in place. Hydrate as instructed until the cutoff time and try to get some rest. If any issues arise overnight, do not hesitate to reach out to your healthcare provider. Thanks all for this T minus one episode evening. So remember to sleep well. You are not alone in this journey. We are here to support you every step of the way and see you in the next episode, the final countdown to your colonoscopy. Thank you.